Good afternoon, everybody. This is Margie Levin. I'm the Assistant Regional Director here at ADL Southwest. We're just going to give it one more minute as we still have a lot of folks still logging in. If you are joining us today via a computer, you can use the chat function as part of Zoom to input or submit any questions you have for any of our panelists today. We also ask that you remain on mute during the webinar so that we can hear our panelists as they present. Also, I want to remind you that this event is being recorded and we will have the recording available shortly after the event. Again, thank you so much for joining us, and we'll get started momentarily. Good afternoon and welcome. My name is Margie Levin and I'm the Assistant Regional Director at ADL Southwest. I want to welcome all of you for joining us today and thank you for spending your time with us today on this very important topic. I just want to let you know that this webinar is being recorded and we will have the recording available after the webinar. And I also want to remind you that we do have the chat function available. If you do have questions for our panelists, please utilize the chat function for you to ask your questions. And without further ado, I would like to turn it over to Debbie Kearns.
Thank you to everyone. Thank you to everyone for attending today's webinar, The Disparate Impact of COVID-19 on Communities of Color. My name is Debbie Kearns, and I serve as Vice Chair of ADL Women's Initiative. The mission of the Women's Initiative is to unite diverse women professionals in ADL's effort to promote respect and challenge bigotry through dialogue and awareness. In alignment with these objectives, we are here today to create awareness around impacts that COVID-19 is having on communities of color that may not be part of the mainstream discussion. I will now introduce Yvonne Harris, Women's Initiative Chair, who will facilitate today's webinar. Yvonne?
Thank you, Debbie. And thank you, ADL Southwest, for hosting this webinar and for all the impactful programming ADL has sponsored for our community since the onset of COVID-19, the death of George Floyd, and the subsequent protest. Special thanks to Nicole Gibson, ADL Southwest Regional Board Chair, and Mark Tobin, ADL Southwest Regional Director, for your leadership as we're working to navigate through these recent headwinds. ADL's work to secure justice and fair treatment for all is just as relevant today as it was back in 1913 when ADL was founded. Today's event is consistent with previous Women's Initiative programming, which aimed to highlight, as Debbie mentioned, lesser known or discussed issues that impact our community and gather diverse thought leaders like our esteemed panelists and each of you, our participants, to bring forth solutions to empower each of us to contribute to the efforts that are much needed in our community. To this last point, we have structured today's webinar by interacting with each panelist on a one-on-one basis or one at a time, so we can focus on each specific area of need and allow for a clear call to action for those of us who after this call would like to contribute and be a part of those solutions. We have a limited amount of time, so let's get started. Joining us today are Cheryl Drazen. Hi, Cheryl. Vice President of ADL Central Division, Jennifer Herring, Director of Reentry Services for the Harris County Sheriff's Office. Hi, Jennifer. Dr. Carla Ortiz, the Women's Specialist of Houston at Texas Children's Pavilion for Women, Vice Chair of the Texas Maternal Morbidity and Mortality Review Committee, and co-chair for Improving Maternal Health Houston. Hi, Carla. And last, Juliet Stepecki, who's Director of Education for Mayor Sylvester Turner's office. Thanks, Juliet, for being on. Okay, so we'll start with Jennifer. Jennifer, can you unmute your line?
Can you hear me?
We can hear you.
Great. Good morning.
Good morning.
Hi, everybody.
Oh, there you go. We see your smiling face.
Okay, you see my whole office.
Yes,
Okay.
I see your whole office.
Whole office. Okay, I'm gonna adjust my screen. Okay, there we go.
So Jennifer, you're with the Harris County Sheriff's Office. You're at the jail.
Yes.
Let's just get started. Center us in the data. What happens when someone in jail tests positive while incarcerated?
Well, there are many things that happen before you get tested positive or negative. You have to be quarantined when you come into the jail. Right now, we have roughly 8,000 inmates today, with 48 presumed positive for COVID-19. Today, we have 1,612 inmates that are in quarantine. So if you are arrested, you would then be put in quarantine for 7 to 14-day isolation with testing before you are released into the general population. Right now, total HCSO patients that have been identified as PUI, which is persons under investigation, and or confirmed since the beginning of the pandemic is 3,830. 1,093 are total HCSO confirmed positive out of that 3,830. And because we're still in the middle of the virus, we expect that these numbers will be growing. 80% of our jail population are African American, so they would also fit to this data as being the majority of these people who are testing positive are people of color.
So Jen, just so that we're clear, give us the number of confirmed tested positive again.
The confirmed tested positive since the beginning of the virus is 1,093.
Okay. So what are the challenges of prisoners when they are released and exposed to COVID-19 or they've tested positive?
right now, our largest challenge is housing, where to house people who would typically be homeless or chronically homeless, or those people who are situationally homeless. And we define those as people who have ended up in Harris County and been incarcerated in Harris County that may be trying to get back home. We also identify those people as people who may have had issues with the family member and cannot return to their home and are temporarily homeless. And then we have those issues where people who have come through the jail, they've been exposed, and they are going home to people who may be vulnerable. We had a guy the other day that said, I can't go home because my girlfriend's pregnant. And I've been in this jail now for a couple of weeks, and I've been around people who may have been exposed. So he needed to quarantine. And that is an issue with us having adequate housing and transportation resources for people who are moving back into the community.
So Jen, is there a transitional plan in place?
There is a temporary transitional plan in place. So because we weren't prepared for this pandemic, we've been very creative in trying to fill in some gaps that we see that the virus isn't leaving as quickly as we thought it would. So if somebody said, oh, by June, we would be back to normal, and we see that June, we're not close to normal, then there maybe needs to be some permanent plans put in place and how we can continue to provide services to people who are moving from incarceration. And these people look like everybody. They're mentally ill, they're elderly, they're people who have gotten in, situations that have ended them in jail that not necessarily, we don't know, guilt or innocence. That's not my role, but people who need help. Everybody who comes out of here needs a lot of help, and we don't want to infect the community more than it is, but we also want to help these people who are transitioning. We have a hard time being able to social distance in a population of 8,000. On top of that, sheriff's office staff in a very tight, enclosed spaces. So I think our medical staff has done a phenomenal job in keeping the numbers where they are, and not being as high as some other cities that are as large as us. So there's a lot of issues. We've got issues in the community with shelters being closed because of COVID, or not open because of the pandemic existed.
So key components of a transitional plan would include housing,
Yes.
transportation,
Yes.
and what other categories?
I would say some type of support services here. Everything we do is through case management, which is actually walking someone through the process. And I've been very adamant in moving people through a process that allows for a continuum of care. That means that there has to be a person that actually assists them in that process, whether they're going to a hotel, whether they're going to a treatment facility, or some type of transitional housing, that there is someone on the outside to facilitate that process.
So Jen, you've been so supportive of Women's Initiative and ADL for so many years. I know you're a familiar face to a lot who have joined this call today. And I imagine that there are people participating that just want to say, okay, well, how do I help?
Yeah.
What can I do? What do you?
Well,
And if we want to make an impact.
Throwing it out there for the need, and the need is critical. We want to try to get this pandemic under control. We want people to isolate. So I'm going to say, in any way people can help in that area where they think about housing, where they think about monies that can house, when they think about housing facilities. We've used hotels. We had to be very creative in identifying a couple of hotels that we could send these people to quarantine when they leave the jail. So whatever in that area, transportation, vouchers, a donated van, whatever people can think of that can help us in those areas, we are welcoming the community's help.
Thank you. That's
Thank
very
you.
clear, and we appreciate all that you're doing for the community.
Thank you. Thank the ADL. Thank you.
Hi, Carla. How are you? Let's get you unmuted.
Unmuted, yep.
Oh, we can hear you now.
Thank you, thank you.
Carla, your area of specialty is obstetrics and gynecology. I knew I was going to stumble when I had to say that. But you can also share some insight as to the impact COVID-19 is having on the healthcare system at large. So based on the data and the updates that you're getting, is there a disproportionate rate of infection and death among community of color?
Yes, I want to first thank you, Yvonne, for inviting me, and I thank the ADL for having this important conversation. I'll also quickly say, as you can see, I've got my head covered. If you were meeting me in the hospital, you'd see me behind this, and also behind this, and that's going to be important as we continue this conversation. So first things first, the data on the impact on communities of color, African American and Hispanic, Latino communities have been impacted, just as Jennifer said, in the jail. We're seeing the same thing in the greater community. At a national level, the CDC released information just in this past week showing that African American and Hispanic communities are 5 times more likely to have COVID infection when compared to non-Hispanic whites. We're seeing the same thing at a state, county, and city level. We're really fortunate in Houston, as Jennifer alluded to. We have not had quite as high numbers as some of the other large states. However, communities of color have been impacted in a much greater way. One of the problems, though, is that the data is incomplete. When we look, 35% of the COVID cases are among, quote, unknown, because, of course, race is self-reported, and there are a lot of reasons why people of color, minority people may not want to give their race at the time that they're tested. Fear of losing jobs, fear of being mistreated, an inherent fear, if you will, of institutions, medical institutions in particular, based on a long-standing history of structural and institutional racism, impacts individuals' willingness to even share their race. And so the data that we have is incomplete for that reason, and also because it really wasn't until I'd say about 6 to 8 weeks ago that in our area, the data was being tracked. Some states still are not even tracking the data. So I'm happy that Harris County as well as Houston are tracking data as best they can, but most of the data being tracked is around death from COVID and not necessarily the infection. I will say that as for actual numbers, Harris County has had 30,729 is the most recent number that has been released. So that's number of infected. We've had 376 die, so that's a 1.2% death rate, and about a 14% positive rate of those who are tested. Limited testing, though, tells us that that number I gave of 30,000, they're saying that there's probably, for everyone tested, there's probably 10 others who are positive. So we're probably talking about 300,000. So that's a pretty big number when you think of our population being 4.7 million.
With the surge of COVID-19 infections, what are you seeing in terms of maternity patients who are delivering, who are testing positive?
So again, really grateful that initially we were shut down. The state shut down early, and we didn't see as many pregnant women testing positive if you look at from, I'd say, March until May 1st. Now, I think I shared with you yesterday, in the last week in my facility, so we've seen a doubling in the number of COVID positive women from one Friday to the next. And I believe we're kind of at the tip of things. We're just at the beginning. I can report in Dallas at Parkland, which is one of the larger maternity service hospitals that serves communities of color. They've had an 18% positive rate among their pregnant women. And so hospitals like Ben Taub and LBJ, which also serve communities of color as well as economically challenged, are seeing a much higher number of women who are impacted. So we're seeing an increase, I think, is the short answer in this last several weeks.
Carla, can you share what happens when a mom who tests positive comes in to deliver?
Yes, and I will say the mask that I showed you, normally I just took off my gear. As you can see, we're coming from my office. I have on scrubs. Normally when I would meet patients, I might have on clothes. I wouldn't have my hair covered. I put on earrings for this meeting, but normally we don't have on jewelry. We have the N95, we have another mask covering it, we have on goggles, and we have on a helmet when we walk into the room. So all you can see is maybe the person's eyes. And that's, the helmet is for if you're tested positive. If you're not positive, we're still wearing full protective gear because of the fact that in our offices, we're not testing everyone. So now you asked if you're positive. This happened last week. A woman came in. She had no symptoms. She had no job that put her at risk. She had no family member that she was aware of that was positive, and she tested positive. So I met her via telephone. I did not go into the room until it was time for delivery. So the person who was going to deliver her chatted with her over the phone to make sure that everyone was okay. The nurse cared for her directly, and when it was time for delivery, I went into the room fully covered, delivered her baby, and passed that baby to a nurse who took the baby out of the room. When a woman knows that she's positive, at least she's been told in advance that there will be a separation from the baby. But for that woman who comes in not knowing that she's positive, just in labor and excited for a delivery, she's placed into isolation. She's cared for one-on-one by someone who is completely in protective gear. A doctor delivers her and her baby is immediately taken away. Both of the patients that I've personally delivered who were COVID positive reacted the exact same way, with uncontrollable crying, wailing at the thought of being separated from their baby. It brought up memories, thoughts of what happened in slave days where babies were born and taken away. I cannot imagine the mental anguish that this situation causes for a woman. And that's something that, as we get into the conversation about unintended or unexpected consequences of this, the sheer the idea of being separated is driving women to think about not coming to a hospital or a birth center to deliver, which is, we feel, not best and not safe. The idea of having to find someone to take care of that baby, another family member who will have to care for that child for 14 days while we wait for the mother to either become symptomatic, or if she is symptomatic, to get over her illness. So that kind of separation is something that I think no one can really prepare for. The isolation, the care by people who, out of necessity, you know, our healthcare team has to protect themselves so that they can care for others. And so you don't have the same joyous experience that you would otherwise have.
My heart is hurting as I hear you describe this, but that's why this forum and other discussions that are happening throughout the community, Carla, are just so important. And when we talk about, or I hear you say unintended consequences, or we think about underserved communities, what are some of the other challenges that COVID has brought about for those that have limited resources or limited access to quality healthcare or limited support at home?
Yvonne, thank you. And I want to mention such a great question. Jennifer touched on many of the things, and it's sad to think that the same things that are happening in the jail are happening in the greater community. And yet, I think that's what we would expect. The social determinants of health, where we live, so where we're born, where we live, where we learn, so where we go to school, where we work, and where we play, where we socialize, have a great impact on all of these outcomes. So women needing childcare for not only, I described the woman who delivers and her baby has to be cared for by another family member, but what about her children at home? We've had women who are working. They may work in healthcare. They may work in a nursing home. They test positive, and now where do they quarantine? I have a patient who, you know, there's only one bathroom in the house, so how can she separate? Women who are trying to protect themselves. If you are one of those who works in what we call the essential things, so you're in transportation, you work in a grocery store, you work in a hospital, who's taking care of your children at home? Who is delivering food to you? How are you keeping from having to go to the grocery store? Communities of colors, African Americans and Hispanics, Latinos are more likely to have jobs on the front line, if you will. So they're more likely to be the medical assistant in the hospital. They're more likely to be environmental services. They're more likely to have to take public transportation, less likely to be able to stockpile. So all of the suggestions that the more affluent community has been able to do to stay home, to limit the number of times you go to the grocery store, to not have your children in daycare, may not exist for those who have those frontline jobs, who are not able to telework, who don't have paid time off, who don't have sick leave, who don't have insurance, even getting tested. We're really fortunate in Houston. We're one of the 4 out of the 6 large cities in Texas that actually has free testing sites. And yet, if you have to work, do you have 2 hours to go sit in line in a car at a free testing center? Do you have a car to sit in a free testing center? So these things bring up thoughts around that, the psychological impact of being told that you may be at more risk for getting COVID. And then there's been myths out there. Originally, there were people who said that, oh, Blacks and Hispanics have less likelihood of getting infected by COVID, which is totally untrue. And so I really appreciate this forum giving an opportunity to give accurate information to those who are most at risk.
Well, and Carla, I don't even have to ask you now for a call to action. In what you just shared, there were at least 24 of them that any of us who know a working mom or a mother of a newborn could jump into action within our own sphere of influence, our own tribes, and be of help. So thank you for sharing all of that. I'm sure there are going to be some questions for you at the end, but as always, Carla, you've been so supportive of ADL's Women's Initiative, and you being here today means a lot to all of us.
Thank you. Yvonne, may I have 1 second to say one thing?
Of course.
I just want to take this opportunity to say, common sense precautions. If we can promote common sense precautions, mask wearing protects others, social distancing, hand washing, and as you said, connecting people with resources, helping the community to cope with the stress that we're all experiencing, I think makes a difference. But I just have to emphasize, wearing a mask makes sense. I got a great meme that just said, mask wearing is an inconvenience. If you consider an inconvenience an oppression, you've never been oppressed.
Thank you for that. Yes, thank you for all those reminders. We appreciate it. Juliet, how are you today?
I'm well, thank you.
Thanks for joining us.
Thank you. It's a pleasure and an honor also to be able to serve on such an amazing panel. The words of wisdom that have been shared have been very inspiring.
Absolutely. It's great to have you back on another Women's Initiative panel. So we always appreciate your time, Juliet. Help us understand big picture, how communities of color are challenged with being able to continue their schoolwork due to lack of technology resources in many of our homes in underserved communities.
Well, this has been a challenge that has been with us for since the onset of technology. There have been a lot of different areas that have tried to incorporate digital learning into the classroom, but COVID-19 has brought it to an emergency. It is not something in which like, oh, a computer and internet access are a mere convenience. It is an absolute requirement now. With us to be able to have physical distancing to prevent the spread and the contracting of COVID-19, we need our young people, our students, to be able to have access to technology, to equitable access to both a hardware, which is typically a computer or a laptop, to internet access, and also to digital instruction and curriculum. And folks are saying that there's a significant need for digital literacy for both the teachers and the students and their parents. And so we know that there are so many children in the public education system that are Title I or economically disadvantaged. And we are trying to develop a system where we can focus on digital equity to allow all of our students, especially in this region, to be able to have the critical access to the tech that they need to be able to continue their studies. The bridging the digital divide is now a question of educational access. Mm-hmm. It's truly an issue of justice and equity.
The information you share, it ties a lot to what Carla was saying and what Jennifer's saying. I'm seeing the common thread now that's connecting what everyone's sharing. And I guess, Juliet, to this question, in many of the communities of color, parents have to go to work and they're not able to be at home to support the continued education of their students. So what structure is being put in place that ensures that these children have the appropriate supervision to complete their curriculum?
So this is, I tell folks, it's like we are now entirely rethinking the way we need to deliver education. The K through 12 system, is having a greater area of challenge than the post-secondary system, which was able to transition and pivot to digital learning much more successfully. So you had, like Rice University, that before the COVID shutdown, they were only offering like 3 courses online. And then after just spring break, they were able to reopen and have like 1,000 courses or something along those lines. So, but in the K through 12 system, you have approximately in the greater Houston area about 1.2 million children in this region 4 area, and you have a significant, like HISD, you've got a number of children, about 76% of the population is economically disadvantaged. In A-Leaf and Aldine, this hovers at 83 to 88%, so even higher levels. And then like you said, parents, they need to work, many are essential workers. And so what happens? That is, we've had several conversations, and as a part of the Mayor's Health Equity Response Task Force, there's a technology subcommittee. And we've had several conversations with the county and Region 4 and the school districts and superintendents and telecom companies. And I've had someone explain it in a very, simple way that, digital access and equity is like a 3-legged stool, and it requires the hardware, the internet access, and then you also need the digital instruction. Now, going back to the question that you asked, what happens when children are at home and let's say they have a laptop and they need the digital instruction? They need access to high quality, high speed internet. So that way we can offer much more advanced levels of learning. And that requires or allows families to be able to have continued conversations with teachers. And you need to have access to low cost, no cost, high speed internet to be able to allow that to happen. And, it's like, as we have on these Zoom calls, before COVID-19, I don't even think I ever used Zoom. And we all know, like, when we're working online or we're having a conversation, even in this, there was a chat about the audio issues and things along those lines. Children need access to reliable internet service for them to be able to have a responsive dialogue and a rich learning opportunity. And so digital equity means access to reliable at-home, personal, low and no cost high-speed internet access, and a keyboard-enabled portable device such as a laptop or a tablet. And both of those are needed. And then we also need to do the investments and supports to help teachers, support staff, and parents. This is a work in progress that's going to take all of our efforts working together, pulling together, being creative, and helping empower families, especially the most vulnerable. And so, we've really been looking on how we can expand opportunity through technology.
I love your passion, Juliet, and every time I hear you speak, that's the quality that just kind of jumps from you. You did something as you were sharing that was so powerful, and it really resonated with me. You took a deep breath. And I think in times like these times that we're facing, you just reminded me the importance of we just have to breathe. Yeah. And just take a moment sometimes. So thank you for that reminder. I don't even think it was intended, but it showed up in the space. So I want to thank you for that. As you use the term digital equity, I ask myself, is there a silver lining with the impact of COVID-19? I know that might seem strange, just the preamble, but is it forcing us now to focus on children's education in terms to greater infusion of technology and quickening the cadence to which we are getting technology and access into underserved communities?
Yes, the city's health, well-being, economic future is dependent on a robust, vibrant public education system that empowers all communities to be able to succeed. We now know that what used to be considered a convenience or by some a luxury is now an absolute necessity, just like clean water and garbage pickup and things along those lines. Technology and the access to hardware and instruction and internet access, as I've described, it should be a public good, easily and readily and reliably provided to our communities. And we did not have an opportunity to be able to be in a situation that propelled us and compelled us to move forward with such vigor. And if there is a silver lining, it's that in the space of being away from the systems of support that we have grown accustomed to and relying on a way that we have to transform our ways of delivering education, medicine, all different sorts of things that we have now that we might have taken for granted, but now have to transform our means of delivery. That gives us an opportunity for us to think creatively, to empower and involve the community to be able to have a deep appreciation and understanding and rapport and dialogue, so that way we can better serve. And in a lot of the conversations, especially those with education, it's been interesting to have very advanced dialogue with telecom companies, with Region 4. I want to say, the superintendents, everyone even at the TEA has been very much focused on this issue. But the bottom line is, like, how do we best serve the children, their parents, and the community? And, someone who has looked at educational equity and excellence, this is something that the crisis begs us to respond. And now the necessity of us remaining safe demands that we find a solution now. And so I would say that I've been very inspired by the working groups. I've been inspired by the people that have been at the forefront, and thinking of creative solutions like CompuDot, which takes old computers from, well, not even old, but used computers from, various sources, whether, from families or from businesses, and provides them to the community after they've been refurbished, and also just looking at the call to people quilting and braiding resources to be able to focus on digital connectivity centered in communities, such as our libraries, our community centers, our clinics, but also in providing Wi-Fi hotspots and things like that to families in their home.
Juliet, I'm getting some great feedback in chat, so help us get a little granular in terms of call to action. What can we do to bridge the digital divide? There's a question, can we raise money for laptops? Can we work with an internet or cable provider about gaining access to digital or to less advantaged neighborhoods? Can we tutor via Zoom?
Oh, yeah,
you have
a
number of
mention
people here who want to
Yeah.
help, so give us some low-hanging fruit if you can.
Well, I will say, it's like about the tutoring and the mentoring. There's like an example, like iEducate is a fantastic organization that used to embed college students in the classroom to support learning and instruction, especially differentiated instruction in classrooms. And now we're CompuDot and iEducate are working together to try to get the laptops and also getting college students to provide the tutoring and the mentoring using technology, right? So, so what are things people can do? Well, there are great organizations that I've mentioned, like, CompuDot. There's also the City of Houston, the HER task force, collaborating with the county on working with these various telecom companies. We can share, kind of like we're trying to develop a playbook of what we can do to be able to support school districts and communities. But I think it's like, folks can write their elected officials talking about how this is something that is critical and important. There are CARE Act dollars that have been provided at the state level to elementary and secondary institutions. And those dollars, if we can have some advocacy saying that it would be good for those fundings to be invested to help bridge the digital divide. There is currently a connectivity task force at the state level that is looking at this question. And I think that, as more people become aware of this, it would be great if we could have, advocates, push forward for what we've described and discussed in this conversation. And also I can send information about, for instance, like CompuDot, and also, iEducate and other partners that we've been working with at the city. And folks can reach out to the telecom company and say that, this is something that's really important, and they would support, the local folks in making sure that we're all working together on solving this problem.
Thank you, Juliet. Please don't go anywhere. There are a lot of questions coming through. We're going to pivot to Cheryl and then come back to all of the panelists. Hi, Cheryl. How are you?
I'm great. It's a pleasure to be here.
We're so glad that you're here. So you've heard a lot today from some of our community leaders here in Houston, but we're thankful that you're here and would like for you to share with us how the ADL is responding to the impact that COVID-19 is having disproportionately on communities of color. Getting a little tongue-tied there.
Absolutely. Well, unfortunately, this is not the first time that ADL has seen disparate treatment. In 107 years, we've seen a storyline like this before. And so we're doing what we always do. We're standing up, we're speaking out, and we're sharing facts. And by standing up, a program like today, for sure, but we are trying to elevate voices. We build coalition. Houston could not be a better example of a community that works together, that understands ADL's mission to secure justice and fair treatment for all means that if someone is suffering injustice, there is no justice for anyone, and that we all are in this together, whether we are on a front line at any particular time or not. I'm reminded of the kind of famous ADL folktale of Ben Epstein, who was a national director who marched with Dr. King to Selma. And as you all know, historically, it took 3 times. You run out of things to talk about, I'm assuming, at some point. But the story goes that Dr. King asked Ben Epstein, what are you going to do? We'll make it to Selma this time. We'll make it across the bridge. And Ben Epstein says, I'm going to open, this is about voting rights, and I'm going to open an office in Manhattan about voting rights. And I'm kind of reminded of the old Pace Picani commercial where someone says, New York City, but supposedly that's exactly how the conversation goes down. And Dr. King says, I think if you want to work on voting rights in the South, an office in Manhattan may not be your best bet. And Ben Epstein said, you're 100% right. And he apparently didn't have great geography. He knew that LBJ at the time was a leader. He said, Texas needs more ADL. We're going to add some more ADL to Texas. I want to get near that guy. I know he's going to be a leader. And he put his finger down right on DFW. Not exactly LBJ's backyard, but it opened our Dallas office that for several years focused only on voting rights. And so getting involved in community, being in the trenches, being able to work in a community with people who are experiencing what is going on is exactly how we're responding to this, just like we do with every issue that comes our way.
Cheryl, given your unique perspective and your role within ADL, share with us the work of extremists at this time, and they're using fear of the virus to spread hate that's directed towards immigrants, the Asian community, the LGBTQ community, Jews, and others. What's the impact that it's having upon those who are being blamed or scapegoated for causing or spreading COVID-19?
It's a great question, and how I wish that hate had to follow the social distancing rules that we are supposed to be doing. I wish that it had to stay 6 feet away from another person. I wish it put a mask on, but it doesn't. And we know historically, when economic times are difficult, hate rises. That is, we can look at that throughout history. So I have to say we weren't shocked to see a spike coming out of what was considered to be an overall strong economy. And I think realistically, we have to brace ourselves for what's going to be several years of economic challenge as we rebuild. But there are two victims when you ask about extremists directly. There's the individual who is being picked on, whether it is on social media or physically, and we have sure seen some of both. But there's also the community they represent, because the message is not just being sent to, hey, you, I'm coming after you. It's I'm coming after you because you are Asian. I am coming after you because you belong to a community that I want to blame for the difficulty that I am having right now. So the duality of those victims makes the impact like a double punch. And I think that is a really significant mind shift piece that we have to understand, that we for sure have victim response that aids the person or the institution that's been harmed, but that we also have to be concerned for the entire welfare of the community, because it's scary, very, very scary for any marginalized community to know that someone is coming after them for an immutable characteristic that they cannot and should not have to change about themselves.
So I know ADL has been very busy in the space of victim response, but talk to us about other work that's being done to basically combat this coronavirus hate, I'll call it.
Sure. Part of it is tracking. Is really trying to notify and see incidents and see trends as we see things moving. In Texas, we are often not the trendsetter, even as we're seeing in response to this disease, that we follow what happens on the coast. And then we see our own things. So we are sharing that information as we see it coming, because the hate is equal opportunity. If we see something going on the East Coast or the West Coast, we can definitely know that it's going to come. It's going to, the internet is a community builder always, but right now when we are all in virtual space, and I'm so grateful for opportunities like this for us to connect from all over and be together, but there's a lot of bad that comes from people's use of the internet, and it lets people with very bad ideas share their very bad ideas in probably the most cowardly ways ever. In the same ways that ADL worked to unmask the Klan so that you could see who was saying something, people use the internet to share vile, vile ideas without having to share who they are or what they represent or engage in meaningful dialogue about it. And so being able to really follow where those groups are going, what those trends are doing, has been incredibly helpful for communities to have that information to use offensively rather than defensively.
Cheryl, any insight on immigrants at the border that are being detained and they can't get services to be tested for COVID, or if they're COVID positive?
It's a tremendously challenging time right now. It has never been easy to be an immigrant at the border, particularly the Texas-Mexico border, but it is absolutely an issue that we are pushing both with congressional delegations as well as social service agencies. I would say that Catholic Charities right now is probably doing the most progressive and responsive work. I know we are trying to collect action items. If you're looking for one along the border, they create the most amazing Amazon list of exactly what they need. So you can log on and see, particularly even down to the types of formula that mothers are needing for their babies. I know so often we feel like, oh, I remember my kids loved Goodnight Moon, I'll send 20 copies. That may be lovely, but it may not be practical right now. And they provide such up-to-date information of exactly how you can be responsive.
Thank you for that, Cheryl. And to all that are on the panel, I know that our participants have questions. So Cheryl, I'm going to now transition to the audience to ask questions of any of our panelists. So if you'd like to ask a question, if you can please indicate by unmuting your line. I think Margie will come in and facilitate the unmute, and then feel free to ask your question.
Thank you, Yvonne. I know that we have several that have come in via chat. So if you don't mind, I'm going to start with some of them that have already come in through chat.
Okay.
So there was just recently a question that came in about voting rights and access to what does it say? Access to polling places in communities that are heavily in communities of color. So what is ADL doing to help with access to voting and voting rights?
Cheryl, can you help us with that one?
Sure. ADL, our national leadership, actually at our national leadership convention in earlier, I guess it was earlier this month, the month seems to run into years right now, worked on a resolution precisely looking at how important the voting process always is as a fundamental freedom, but particularly in this election cycle when we overlay it with a pandemic and the issues that are going on around us. So whether it will be work, and I think you'll see in different communities, ADL responding differently. Some communities or some states' laws allow mail-in ballots more easily than others, particularly the one we're sitting in. You're also going to see poll access. You're going to see a real push. As you know, right now we are in runoff elections. Early voting there is happening, but particularly an awareness campaign to get people registered for the fall. If you are not registered in time, you are not able to vote. There is not a workaround on that one. And so you're going to see real attention being paid to get people registered. Also for poll access. And I would be happy, and I know the Houston office, to talk to anybody who is interested in really doubling down on voter support in the next few months.
Thank you, Cheryl.
Okay, another question that came in is, how do we make visible the needs of vulnerable persons and communities that bear the enormous burden of this disease? For example, those in long-term care facilities, and what can we do to help with the inequity in health outcomes?
Carla, do you want to take a pass at that one?
I'll take a pass. I
Thank you.
wish that there were an easy answer. There are the things that have been talked about. Certainly, donating or volunteering food delivery services, visitations, those kinds of things where you can, for nursing facilities, you've seen drive-by parades, you've seen things that allow communities that are significantly isolated right now to at least feel that they have not been forgotten. But this is a structural situation. We know that living in communities that have poor air quality and high violence as a result of redlining and inequitable loan qualifications, et cetera. These are the seeds that have sown the disparate outcomes that are just being I've heard it said, we've just taken the Band-Aid off of the wound once again. The wound hasn't healed. We put a Band-Aid on it. And each crisis like this, Corona being no different, exposes the wound that exists. And so the work that ADL does to address racism, address the oppression against other groups, be they the physically disabled, the impoverished, et cetera, is critical. Having these conversations so that we can acknowledge that it's those roots that have created the uneven response in this crisis as with any other. But again, volunteering to provide transportation, giving money to institutions that may be able to provide services in the community like childcare. We mentioned transportation. We mentioned petitioning employers to have paid time off, or at least not to penalize workers for staying home when they're sick, so that we're actually able to do some of the things that would help slow the progress of the infection. So if you're going to lose your job, if you stay home because you have nasal congestion and low-grade fever, you're going to go to work. And then when you go to work, you're going to infect other people. And so if we can help educate both the community on the importance of following the the guidelines, but to impact the business community. So for all of the influencers who are participating in this, to help businesses understand that, you know, it's the policies that sometimes force your employees to do things that put others in danger. So I know that there's a lot, and there are probably other people who would want to jump in. But lastly, making sure that we talked about equity on technology. So eloquently, you talked about the digital divide, and it impacts health as well. We can't make the assumption that everybody has internet access at home, and everybody even has a telephone. So, you know, doctors are now saying, oh, you can't come to the office, we'll do telehealth. Well, who's being negatively impacted by that is the very people who have the greatest burden of disease, communities of color. So it crosses education, it impacts healthcare. So those are some thoughts on that.
Yeah, thank you for that, Carla. I didn't even make the telehealth connection, but now that you did, it seems so obvious. So thank you.
So following up on the telehealth question, a question came in is what happens if people do not have the technology for telehealth or for education and distance learning? What are some of the resources, or what are some of the workarounds for those families who do not have internet or computers at home to do either telehealth or education? So why don't we start with education?
Juliet?
Wow, so you can see that everything in community is so braided and networked together. We oftentimes put things in silos, but when we have a moment like this where we can actually sit back and look at how interconnected things are, it brings us a greater appreciation of the importance of equity and justice, and us advancing that, whether it's in the field of, you know, saying we need more funding for our children in the schoolhouse, but now it's kind of like we need more funding to be able to empower communities with the resources that they need, both in the schoolhouse and in their home. And so the technology now is an access to mental health, telehealth services, standard health checkups. And, you know, it's like the doctor was saying, you know, she said, some people don't even have a telephone, right? And so when I first heard about telemedicine, I didn't put the connection that a telephone is a part of telehealth. Of course, a more advanced version is to be able to have an interaction and a dialogue with your physician utilizing the technology like Zoom and other types of interfacing platforms. And so I think the thing is, it's like, where do we go from here? And how can we better advocate? Well, I think these conversations, ADL's opportunity to get a diverse array of leaders and community participants to work together and look at this issue with fresh eyes will allow us to have a mindset shift to advocate for what we need to pursue equity in a more robust, welcoming way. And so I will say that in February, my perspective on the digital divide was very different from where it is today. Every family, especially the most vulnerable, they need that the hardware, the internet access, and the digital instruction and literacy, because that is the wave of the future. That's how you sign up for pandemic EBT. That is how you get medical care and treatment. That is how you apply for jobs. That is how you get educated. And so we have to appreciate the scope. And, you know, one person told me, I don't know why anybody would eat an elephant, right? But they were like, oh, you eat an elephant one bite at a time. Well, that's what we have to do with this. You know, this is something where we're truly asking for something that's systemically transformative, and it's going to require everybody's involvement. And it gives us an opportunity to be creative. We have, you know, beautiful physicians that tell us, you know, why it's important for us to advance health equity and the link to technology. it's truly a call for us as humans, as colleagues, as brethren, as folks in an interconnected community. If one person gets sick by COVID, the impact on the larger community is exponential. And so we're all in this together in the way we prevent the spread of COVID, in the way we intervene, in the way we try to get resources out to our communities. We have to be able to allocate our funding in successful ways. You know, it's like braiding those resources, whether they're public dollars coming from CARE, standard government dollars that are typically there, and which are, you know, getting shortfall because of, you know, the compromises in the economy, but also the private dollars and the individual acts that people can do in the community. We've got to braid and weave all of these resources together to be able to successfully fight COVID and transform our society into one that's more equitable and just and healthier, both mentally, physically, and spiritually.
It's a great opportunity for great change, Juliet, and I'm so inspired by what you're sharing from the education standpoint, and then also to what Cheryl and Carla and Jennifer have shared as well. So thank you for that. Are there any questions for Jennifer as it relates to transition from the jail back into the community? She stated some powerful things about some of the shelters that are being closed. So those who don't have, you know, housing or stable housing. Any questions for Jennifer? We see you're ready for questions.
Thank you. I know I was looking right here in the chat, and I'm going to expound on the issues with domestic violence. We are, because of close proximity, seeing an uptick in the amount of aggravated assaults on a family member come through the jail. And we know that there's a problem. There's a problem in the community. And when these women leave, as well as reuniting with their children, we don't have place to put them. And a lot of times the women end up in our jail as well for fighting back. The laws are different now, that if there's a mark on you, they'll take the person who has injured the other person. So it might not necessarily be the perpetrator. We have a domestic program here, a domestic violence program here inside the jail. And right now we're having a hard time trying to get placement for women and children. One of our facilities just called me today and told me they had a couple to test positive, so they won't be taking new people until the end of July. So there's a lot going on in the community that I think that we just don't know. People just don't know. So a forum like this to tell people what's happening in the criminal justice system, what's happening in the healthcare system and education system is very important. So I think that this needs to continue. More conversations need to continue. And the public just needs to be aware. Outside of the media, the public needs to be aware of what is happening on the front line, what is really happening. And the media hasn't come to me and said, hey, we want to ask you some questions about all of these people who are mentally ill and are incarcerated. Where are they going when they leave? So that's not the popular story, but it is real life for us right here every day in the jail to try to figure out what we're going to do with these people when they leave.
So Jennifer, Nicole has come into the chat and is asking for those of us who want to connect our resources or have connections to resources, what then do we do to connect those resources to the county to start providing the help that you're seeing need for?
Yeah, not the county. It would be actually the sheriff's office. So they would have to contact the Sheriff's Office Foundation. There's a nonprofit foundation, and it is HCSO .com where they can get that information. Or you can email me and I'll give you her direct access to her email and phone number. But call me. I will gladly get you connected to the right people so we can get these people some help. And I thank you. Thank all those who care about people who are coming through the system. To let you all know, most of the people here that we serve are people that are broken and that are having issues. Trauma mostly we see here, family of origin issues, issues that didn't get dealt with while they were children and have, can you turn that off? And have exacerbated now that they're adults. So that's mostly what we're dealing with here. And I don't know if you all know that the prisons are closed. So our numbers are steady on the rise because they haven't taken inmates for the last 3 months. So we've been trying to be very creative in how to get people in treatment, how to get people in transitional facilities and those that are nonviolent and can be released from jail.
Thank you. Thank you, Jennifer. Last question, and then we are going to wrap. And Cheryl, this one is for you. As we know, when we see a rise in hate, we see a rise in cyber hate. So what is on the radar? What is the ADL seeing in terms of the increase of cyber hate as it relates to COVID-19? Cheryl, are you still with us?
I think she may have dropped off.
Okay.
Apologize for that. I know that ADL does have many initiatives that we are doing, one of which is the Stop Hate for Profit. You may have seen that with Facebook, where we are asking advertisers to stop advertisements on Facebook for the month of July until Facebook agrees to stop promoting and promulgating some of the hate that happens online. So that is one, and we can share that information with everybody on the call today.
Thank you, Margie.
Sure.
And Margie, thank you for organizing this webinar. We appreciate you and appreciate your efforts for making this happen today.
Thank you.
Thank you all. And at this time, we're going to wrap this session and this webinar. Again, thank you everybody for participating, especially Yvonne and Debbie from the Women's Initiative and all of our fabulous speakers. We will have this recording available for everybody within a day or so. And we also will share any of the information and links and resources that our panelists have mentioned and provided. So again, thank you very much for joining us. Everybody wear your masks and stay safe. Thank you again.
Thank you.
Thank you.
Thank you.
Thank you.